So when we're considering complications related to the breast implant itself, there are the three commonest reasons for considering reoperation are capsular contracture, implant migration or movement out of position, and eventual implant rupture. So capsular contracture is due to the presence of bacteria around an implant. They get in at the time of surgery, so there are a whole bunch of steps called the 14-point plan that we utilise in our practice to eliminate as far as we can any bacteria around the breast implant. And as a consequence, in our practice, our 10-year rate of capsular contracture is around 2%, which is very, very good. Implant migration relates to an implant moving out of position. This is one of the reasons why we need to consider activity restrictions after the surgery, so the boundaries of the breast implant pocket stabilise, heal and obtain good strength before the reintroduction of significant exertion and activity. Finally, breast implant rupture is something that occurs not commonly before 10 years, but as we approach 10 years and as we go beyond 10 years, it becomes more frequent. It's basically because if you have injuries sustained in daily living to your arm, to your leg, to whatever, your body will heal those injuries. But the body, of course, can't heal an implant. And just as you can get a piece of wire, bend and bend and bend, eventually there's fatigue of that piece of wire and the wire breaks. And the same thing happens with a breast implant in due course, but it does take a long time for that to happen. There are rare other risks that are important. Breast implant associated anaplastic large cell lymphoma is a rare form of of cancer, a cancer of the immune system. It's not breast cancer, and it is associated with textured breast implants. This is the particular reason why these days it's much less common for us to utilise textured breast implants to eliminate that risk. The problem is, however, textured breast implants are used for two reasons. They are associated with a slight reduction in the rate of capsular contracture, and they're also associated with more stability in terms of implant position, both of which are the two commonest reasons for reoperation. So in that regard, we've moved towards a safer implant with respect to the ALCL or the lymphoma associated with breast implants, but potentially there's a slightly higher risk of having capsular contracture or movement out of position. These risks, though, are still very low. In general, 1 in 100, 1% per year needs reoperation. So by the time we get to 10 years, it's somewhere between 10 and 20%. So 8 to 9 people out of 10 will still have their breast implants at 10 years. And probably as many as 50% or half of people will still have their original implants at 15 years. So the other causes for reoperation or the consideration of reoperation then might relate to things like patient choice, feeling that the breast implant, they would rather have a bigger implant. It's exceptionally uncommon to feel like they wish they want a smaller implant, but it's possible, particularly if there's weight gain and increase in the size of the breast itself. There might be changes to the breast. These could be associated with pregnancies after surgery or weight gain, weight loss, but the nipple sitting lower, the breast hanging a little from the breast implant. These are things that could lead to reoperation but aren't related directly to the breast implant. Or very uncommonly, you'll have people who just don't sit comfortably with their breast implants and they request to have them removed because they feel that they aren't doing what they had hoped or that they no longer require them. And there is also an uncommon group of women who feel that their implants may be contributing to generalised systems that are leading to deterioration in health, and they often refer to this as breast implant illness. I'm involved in research into this, and certainly at this point we're still trying to see if we can identify if there is a direct and absolute link between breast implants and these symptoms. We're doing a lot of research, but still at this point we don't have a definitive answer to that question, but the research is ongoing.